Let's talk about whether or not clients should tell their therapist the truth. Hi, my name is Dr. Natalie Jones. I've worked in mental health for many years now, and I want to have a conversation because this is something that I've seen online where I've seen, several content creators talk about don't tell your therapist the truth, lie to your therapist, or don't tell your therapist everything, or some sort of variation from that. And so I have a different opinion about that. First of all, I discourage people from taking advice when it comes to mental health and mental well-being from a content creator or social media influencer. I am a firm believer in getting the right assistance from a licensed mental health professional. They don't know your history. They don't know your mental health background. So that's first and foremost. And again, while I'm not your therapist, I am a therapist. I'm going to give you some, based off of my experience in working with clients. I certainly have had many, 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 many clients over the years, probably thousands now, if not more than that. Just from my jobs and my internships and all that kind of stuff. And I'm certainly not, new when it comes to this. And I understand that, clients aren't going to tell their therapist every single detail, right? So most of my people, when they see me, we have about an hour every week or every 2 weeks, depending on who it is, right? And so one of the things, you can only get so much out in that hour. So we usually come with an agenda. However, one of the things that I will say is that, there's one thing that I will, I will discharge a client over, or I won't see them over. So one of the things that happens is I have pretty intensive paperwork that ask a lot of questions about background and history and something like that. So I won't see you if you don't fill that out. Those questions are designed for a reason. Those are things that I have curated over the years that lets me know about our work together, and it's going to help me formulate a treatment plan. That's number one. But number two, if you have some substance. So if that's not filled out, I want to say, if that's not filled out, I won't even see people. The reason being is because it doesn't allow me to work effectively, right? So I have a process, and, in addition to my work with you, I still have ethical obligations and things like that. And that's part of it. Like, you do your part, I'm going to do mine. Number two is if there's substance abuse history and things like that, again, I understand that sometimes people may not want to disclose all of that, but if you're on any sort of psychotropic medications, if you're dealing with severe mental health symptoms, I absolutely think that you need to be open with your therapist and your psychiatrist or whoever's prescribing your meds about that. There's a number of things that can happen, so there's such a thing as drug-to-drug interactions and complications, as well as those things can be causing additional mental health symptoms. So it's always a good idea to have an honest conversation. It's particularly when there's medications involved or when you're having severe symptoms such as psychosis and things like that. And most of the time, again, if you're seasoned, like I would consider myself a seasoned clinician. Usually I can almost always tell when someone's lying to me about, drug use and things like that. The other thing would be, thirdly, I would say, when it comes to severe mental illness, so severe mental illness would be something like major depressive disorder, post-traumatic stress disorder, the schizophrenia spectrum disorders, or bipolar disorder. So those would be the things, but again, those are severe symptoms, and it's always a good idea to keep your therapist abreast of, or your clinical treatment team, your therapist, your medical doctor, your psychiatrist. It's always a good idea to be honest about the symptoms that you're experiencing. Even if you don't want to take medications, It's a good idea because, again, there's a lot of people don't understand the liability that goes into being a mental health practitioner. It's not something that you just kind of hop on and say, I'm a mental health practitioner. There's a certain liability and risk, if something were to happen to clients, such as Tarasoff, if someone becomes homicidal, suicidal, right? And then, if you're ever hospitalized, and over the years, I've had people that have been hospitalized. If they're dealing with severe mental illness, I've also had to hospitalize people. So I'll call the hospital and make a direct admission, request a direct admission for someone, if they have and so it's always good to be able to communicate with, the hospital or whatever higher level of care that you need to be admitted to, should it ever come to that. The hospital will also call me, or your treatment team to see, hey, if you were admitted, like, is this person safe to go or not, or what's their history, and that you don't need a HIPAA release. For anything emergent care like that, you don't need a HIPAA release when it's the hospital that calls. It's good to try to get that, but it's not required in the United States. And so it's good to be able to communicate with them and tell them exactly what's going on, as well as them to communicate with me. So it's good to have a good rapport and be honest about the symptoms so that you can get the best help that you need from your treatment team. It's good. In order to do that, though, you definitely do need to have trust. You need to have rapport with your therapist. And I think history is also a good thing as well. And I've worked with, again, some pretty extreme cases over my years. So I've seen people with mild mental health symptoms to very severe mental health symptoms. And usually, it's people typically tend to want to be a lot more guarded when they have severe mental health symptoms and appear to be more normal. And those are usually the higher liability clients. Put it frankly, and not to say that's a good or bad thing, but those are people that you tend to want to keep an eye on the most. And you want to be more up to date on their history, because things can and sometimes do change in an instant with those types of people. So I would say, in order to have the best working relationship, in order to get the best mental health care that suits your needs, definitely try to have more of an honest rapport with your therapist. And it gets difficult if something were to happen, and you have to be hospitalized and you've taken a bunch of drugs or something like that nobody knows about, all because you don't want to disclose what you're taking, or you don't want that information relayed back to your treatment team. Remember, your mental health, the help that we give is there for you. It's not there for me, Dr. Jones or whoever your clinician is. It is there for you, to be the best version of yourself. So, try not to get in your own way about that. And I hope that helps. Thanks